Hey everybody, this is John Oxley from Huntington Physical Therapy, doing my Friday tip of the week. This week I have Bob Martin with me. He is a graduate, we'll say, of our Parkinson's program, but he keeps up with his exercises and comes to our monthly Parkinson's meeting. This is the final kind of video installment I'm going to do on Parkinson's. We talked to Alicia, interviewed her. We interviewed Dr. Nolte, and then I thought it would be good if we had an actual Parkinson's patient that's gone through the program and been to our meetings to kind of discuss his journey, what's gone on with him. It doesn't necessarily mean it's going to work the same way for everyone, but at least it'll give people an idea of what we're dealing with. So let's get started. So, Bob, you were diagnosed with Parkinson's when?
Basically 2 years ago, and I'd had symptoms going back 3 years, and it would took a year to get me diagnosed, but basically 2 years.
What made you feel like you needed to go to the doctor, or kind of told you that something was wrong?
Well, it started out I had some shoulder pain, numbness in my arm. We thought it might have been a nerve issue, and a lot of back. It turned into back pain, and then it started really affecting the way I was walking. Actually, I got to a point that I couldn't walk, and the low point was probably in Cincinnati 2 years ago. I had about a mile to walk to get in the parking lot at a tennis tournament.
Yeah,
it didn't work out for me, so I said I got to get on and do something different here. So it's been a long time.
Well, and I feel like a lot of Parkinson's patients, they start the way you start, with joint pain and some just kind of difficulty moving, and they feel like it's an orthopedic problem that sort of gets misdiagnosed and mistreated for a little bit.
That's kind of consistent with the way mine went.
So they've got you, they sent you to physical therapy. What about medications? What medications are you taking?
I take Cinemet, and that's 3 doses a day. And the 4th is optional.
And optional based on if you're having more symptoms, if you're having a bad day?
Pretty much if I'm going to extend my day, like come home after work and work around the house, or, I ride bicycles a lot. Sometimes I'll take it, just with extended activity more so than anything.
Now, and before we were on camera, we were talking a little bit about his Cinemet, and he's not had to up his dose. You want to talk a little bit about why you feel like you haven't had to up your dose?
I think with everything I've read and doctors have told me and your folks have told me is, my active lifestyle. I haven't sat down with this disease. We stay active, and I think that's helped a lot. The big program, I'll carry a lot of stuff over that I learned in it, and when I find myself digressing, I kind of get back into, the core of what I learned in the big program.
So you've always kind of got that to fall back on.
Yes.
Are you doing those exercises every day?
I don't do the exact program every day, but there's probably not a day goes by that I don't do something or say big, move big. That's one thing you learn.
Yeah.
So I do some shape, fashion, or form of the exercises daily, but I don't do the whole program.
And what would you say was kind of the biggest or best takeaway from the program you did with Alicia?
It taught me, I don't really know how to say, but it kind of puts in mind what's going on and how it happens, and we do movements that are exaggerated. It kind of recalibrates my movements, and it more than anything, it gets my mind working to where, if I'm having problems, I can reset myself and go again.
Because there's definitely a mindset involved that you got to get in with Parkinson's, other than just the physical stuff as well.
I mean, you got to get past the fact that you think you're going to die.
Yeah.
Because everything I see, Parkinson's isn't going to kill me. Something else will.
Right.
So you got to get your attitude right.
And you got to keep, you got to work at it.
That's correct. I mean, it's a daily thing. Exercise and diet. Just getting a regular routine, which is hard for me because I still work full time.
What do you think has been the biggest struggle that you've had since your diagnosis?
Really just, learning to deal with, you can't do some things that you used to do, like I go back and I laugh when I told Alicia one time I was going to ride a hoverboard, and she said no. And you go back and ladders and things of that nature. You know, just I'm an active person, and there's just some things it's probably best I don't do. So that's probably the biggest thing, is to come to grips with that. But that comes with getting older too. I'm not a spring chicken.
Yeah. I mean, and that's true. As you get older, there are things that you can't do. I think sometimes with Parkinson's, it makes it a little bit more sudden for people,
Yeah.
which is a little bit harder to deal
Yeah.
with.
But all in all, I do what I need to do.
All right. So, last question: one or two pieces of advice you'd give to someone that's recently gotten a diagnosis?
You know, get somewhere, get you a good team of doctors and therapists, and you know, work with what they tell you to do. Mainly, stay active. I mean, and you know, don't get on any pity parties, because that's not going to do you any good.
Right.
You know, you're going to be the only one at that party. So you know, just stay active and try to live a normal life. I mean, you know, I'm 2 years into this. I'm sure it'll be worse at some point in time, but 2 years into it, I'm still doing basically everything I've done before. Actually, I'm doing a little more because it's forced me to exercise.
A little bit more than you were before.
More than I was before.
So let me remind people that are watching this, we do have our Parkinson's meeting on the third Thursday of every month. Bob's usually there. Alicia's there. There's some food. They go through some Parkinson's issues, go through the exercises, and just allows you to talk to other people that have the diagnosis. Well, Bob, thank you for letting us interview and be open about Parkinson's. If anybody has any questions or feedback or comments for us, please send them on Facebook. You can call and talk to Alicia Wallington if you have questions about our program. Thanks. See you next week.